An alarming new COVID variant raising concerns around the world. The WHO labeling the newly named Omicron variant a variant of concern, first detected in South Africa and quickly spreading. President Biden ordering a travel ban effective Monday for foreign nationals from South Africa and 7 other countries on the continent. Canada, the UK, and EU are issuing similar bans. The president warns there's a lot we still don't know about the variant, which seems to spread rapidly. Scientists warn this new variant could be more transmissible than the Delta strain. It contains a large number of mutations. Dr. Anthony Fauci says it's too soon to tell if it can evade current vaccines. Here in the U.S., health officials on high alert for the new variant. Delta currently makes up nearly all new cases. At least 35 states report an increase in infections, hospitalizations on the rise for 3 weeks in a row. Today, President Biden saying the pandemic will not end until we have global vaccinations. ABC's Trevor Ault leads us off tonight.
Tonight, health officials around the world sounding the alarm about a rapidly spreading new variant first identified in South Africa, B11529, now known as Omicron. The World Health Organization labeling it a variant of concern.
This variant has a large number of mutations, and some of these mutations have some worrying characteristics.
Today, the Biden administration joining more than a dozen other countries, moving swiftly to restrict flights from southern Africa.
We don't know a lot about the variant except that it is a great concern. It seems to spread rapidly.
Early evidence suggests Omicron may pose a higher risk for reinfection, and scientists fear it could be more transmissible than the Delta variant, and the vaccines could be less effective against it, though experts like Dr. Anthony Fauci caution it's too early to know for sure.
Right now you're talking about sort of like a red flag that this might be an issue, but we don't know. Once you test it, you'll know for sure whether or not it does or does not evade the antibodies that we make, for example, against the virus through a vaccine.
Omicron cases have also been detected in Botswana, Israel, Hong Kong, and now Belgium, where an unvaccinated woman with no connection to South Africa tested positive after returning from Egypt. Now officials in Europe, where some countries had already reinstituted restrictions and even lockdowns from a Delta variant surge, are worried Omicron could be even more damaging.
We are concerned that this new variant may pose substantial risk to public health.
Right now, there's no evidence the Omicron variant is in the U.S., but experts believe it's likely just a matter of time.
You were on 2 airplanes?
Yes!
And even after the return of a more traditional Thanksgiving, with millions of families reuniting, America is also seeing troubling signs of a potentially looming winter surge. 35 states and Washington, D.C. reporting cases up at least 10% in the past 2 weeks. And now military teams fanning out to hospitals from Minnesota to Colorado as reinforcements for exhausted healthcare workers.
And everybody who's here working are so tired and frankly very broken individuals, and we don't have a lot left to give.
Healthcare workers just running out of steam. Trevor Ault joins us now. Trevor, there are still so many questions about this new variant, how transmissible it is, if it's more deadly. When can we expect to get those answers?
Well, Lindsay, the World Health Organization says there's already several studies underway in the field right now, and those will take days or weeks to complete. Typically, they can figure out transmissibility fairly quickly as a variant spreads. And Lindsay, we should also mention Moderna says they're already working on possible tweaks to their vaccine just in case. Lindsay?
Trevor, thank you. We know a lot of you have questions about this new variant. Let's get right to Dr. Ashish Jha, Dean of the Brown University School of Public Health. Doctor, thanks so much for joining us tonight. What in the early data on this new variant makes health experts concerned?
Good evening, Lindsay. Thanks for having me here. Couple of things. First is that we're seeing a real takeoff of this new variant very, very rapidly across South Africa and other countries. And second, we're seeing mutations in the virus that are very concerning for how well our vaccines are going to work against it. So both of those things have us concerned.
And doctor, really a two-part question here. How soon will we know if the new variant is vaccine resistant? And we already know Moderna is tweaking its vaccine booster to fight this new strain. How easily can that be done?
Yeah, so I think we're going to have some preliminary data on how well our vaccines are holding up by early to mid next week. Which will be really, really important, and we'll have some of that very quickly. More definitive might take a couple of weeks. You know, the vaccine makers can make tweaks pretty quickly and produce new vaccines probably within a month or two. So I think there are a lot of opportunities here to make changes if we need to.
Does the emergence of the variant only further reinforce the need to ramp up vaccinations globally?
It does. It does. You know, we're not out of this pandemic. Here we are in Thanksgiving. I expect us to see a bump in cases across the U.S. next week. Globally, there's still a lot of places with large outbreaks. We really got to get global vaccinations back on track and people vaccinated.
Dr. Jha, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.